And we are back on the WHHI-TV Daily News. With me now is Dr. Sam Fazio, and he is, I want to make sure I get this right, the Director of Psychological Research and Quality Care for the Alzheimer's Association, the National Alzheimer's Association. Thank you for being here today. We're going to talk a lot about what's going on and some numbers that have just come out, but I think what we want to really kind of talk about today is the caregivers and what the stressors are for them, and maybe there's not quite enough resources. So let's jump in and talk about that a little bit.
Sure. Well, let me start with the large report. So the Alzheimer's Association Facts and Figures shows that Alzheimer's disease continues to significantly impact people living with the disease, families, and our nation as a whole. The new numbers show us that 6.9 million Americans currently are living with Alzheimer's dementia, and it's costing our nation about $360 billion, which, if you look at it into perspective, that's $15 billion more than it was just a year ago. So you can see how big of a public health crisis this has become.
Absolutely, and of course that doesn't even count the hours of unpaid care that goes into it with family and friends. So I mean, that number, if you added that in, would be even more astronomical. And so let's talk a little bit about that, and you know, because I think something that came out of the report is that maybe there's not enough support for caregivers in the home, or people dealing with this. So what can we do to be better, and what are some of those stressors that they are facing?
Sure. Well, two big takeaways from the survey. One is with healthcare workers, and then one is with caregivers. So healthcare workers, about 60% of them told us that the healthcare system isn't really equipped to help an individual or their caregiver navigate their way through this disease and the system. And then at the same time, the vast majority of caregivers say they want and they need help. And they need help with things like, coordinating doctor visits, finding local respite services, or really, very simply, just having somebody available to talk with them about the disease once they get this diagnosis and they have to find their way. And like you mentioned, there's a lot of stressors. And, the biggest stressor, 70% of folks that we surveyed really tell us that coordinating care is a really big stressor for them.
Well, absolutely. And of course, a lot of these people are going to be caregivers are going to be navigating something that they haven't ever had to navigate before. And so what are some of the resources that are in place now? Like we said, maybe not enough in place, but what are some that are in place that they can reach out to right now?
Right, so navigation does exist across the country, but it's really not consistent. It's not consistently designed. There's different models. It's not necessarily accessible and affordable for everyone. But we hope that this report could really serve as a catalyst so that people could start thinking about how to put more services in place to really help people navigate the system and the disease. So one thing, for example, that a health system could do right from the start is really just, can you dedicate a person who is available to answer questions for people after they get this diagnosis? A lot of our families will say, I received the diagnosis and then I'm sort of sent off on my own to figure out what to do next. So one easy next step is to have somebody available within these systems that can help families answer their questions.
Well, Dr. Fazio, thank you so much for being here today. It's very important information. We appreciate it.
Thank you for having me. I appreciate it.
Thanks to everyone on the show today for their insights and contributions. As always, our production team is behind the scenes to make all of this possible. And of course, we are honored that you have chosen to share a part of your day with us. I'm Betsy McDaniel, and we'll see you for the next WHHI-TV Daily News.